Bob Kerrigan back with you on the Law Show. Thank you very much for joining us and to sending text messages to us. It helps us a great deal. And you tell us what you want to know more about. And one of the things that people are concerned about, and logically and understandably, as they go into their retirement years, is how does Medicare work, and what can I do? What mistakes can I make in Medicare? What not to do, and all of that. And we have the expert available to us today, Danielle Kunkel Roberts, who is going to be on the phone with us in just a second or two. And her book is 10 Costly Medicare Mistakes. I've told you all about this and told you we were going to have her on. Delighted that we have her. And so at this time, I am happy to introduce Ms. Roberts and welcome you to the Law Show.
Well, thank you. I'm so happy to be here with you today.
All right, what we're going to do is start with the big picture. Give us the big picture. Everybody's heard of Medicare, and they've heard of Medicaid, I suppose, just by the news accounts of stories that are out there about these various government health care provisions. But tell us, in a larger picture, who's eligible for Medicare in the United States?
Of course. So Medicare is our national health insurance program for people who are age 65 and older, and also for some people who are under 65 with certain disabilities. For example, someone who has been on Social Security disability for 24 months or longer, or people with end-stage renal disease or Lou Gehrig's disease. These people can qualify for Medicare early, and that is different from Medicaid, which is health insurance for people of any age that have a certain low income. They qualify based on their low income. So it's possible to have both Medicare and Medicaid if you're over 65 and also low income, but those are two terms that people commonly confuse. So just think of Medicare as being the retiree health insurance coverage. That's how most people think of it.
Perfect. That was my general concept, and I think most people kind of feel that way about Medicare. So you are approaching your retirement decisions, and age 65, I guess that's the triggering age, isn't it, for Medicare?
Yes.
So you're approaching the decision about what you're going to do in retirement, but a big factor is how's your health insurance going to start and what do you have to do? So let's start with that starting line, which is enrolling. How do you enroll for Medicare?
So you enroll in Medicare through the Social Security office or Railroad Retirement Board if you're a railroad retiree. And you can do this online at the Social Security website, which is certainly the easiest way to enroll in Medicare. If you prefer to do things in person, you can go down to your local Social Security office and enroll there. And you can even call Social Security and have them mail you a paper application. So they make it pretty easy to enroll in one of those three methods.
All right. Do you have a time period in which you have to enroll once you reach age 65?
There is. So if you happen to be someone that is still working at age 65 and you work for a company that has 20 or more employees, which is considered a large employer, then you can stay with that employer's group health coverage, which would be primary. And if you enroll in Medicare, it would be secondary to that group coverage. So a lot of people in that situation will delay enrollment into parts B and D, since those two parts have monthly premiums associated with them. And they'll enroll in just Part A, which is hospital coverage that costs nothing for most people at age 65. And then later on, when they actually retire, they'll have a special enrollment to add Parts B and D. If you're not working at age 65, then you have a 7-month window, which surrounds your 65th birthday, during which you absolutely should enroll in Medicare so that you don't end up with a late penalty. And that 7-month window starts 3 months before your 65th birthday month. It goes through the birthday month and then goes for 3 months after. And as long as you enroll during that window, you would not incur any late enrollment penalties. And then you can go and shop for suitable supplemental coverage to cover some of the things that Medicare doesn't.
Okay, we'll get to those supplements and other components that fit in with Medicare. But what if you're an employee of a small company and you've got very good health insurance and your still working and you're 66, 67, 68, but you're still employed and you've got very good health insurance, do you also have to enroll in Medicare in that 7-month window, or can you enroll in Medicare later when you fully retire?
If your employer has less than 20 people, you must enroll in Medicare when you turn 65 because in that scenario, even if you love that group health coverage, it is secondary to Medicare. So Medicare will pay primary. Part B covers 80% of your outpatient expenses, and then your group coverage would kick in as secondary. So really important in that scenario to go ahead and enroll in both Parts A and B at 65. And likewise, if you have retiree coverage from a former employer, Medicare is typically primary to that type of coverage as well. So again, needing to enroll at 65.
All right, so we're going to talk now for a few minutes about the mistakes. By the way, talking with Ms. Roberts, and her picture's on the screen. She's written a wonderful book called 10 Costly Medicare Mistakes. But before I get to your book, what kind of business do you operate that provides services to the lay public in regards to helping people sort through their various decisions they have to make about Medicare?
So I'm the co-founder of Boomer Benefits, and we are a licensed insurance agency that helps baby boomers with their navigation of new enrollment benefits and learning all that crazy Medicare stuff when they are approaching age 65. And we sell Medicare supplements, Medicare Advantage plans, and Part D drug plans. We've been doing this since 2005, and one of the things that I learned very early on is that people out there don't have a very good understanding of Medicare itself and what it covers. So we spend a lot of time educating people first on what their government benefits will provide to them. And then once they have a really good understanding of the costs and features and coverage of Medicare itself, then we help them with enrolling into the supplemental coverage to pay for the things that Medicare doesn't.
All right, we're going to talk about that supplemental coverage in just a moment, but I want to ask a very basic ethical question, a question about the ethics of what you do and what people that provide various services like this do and face. And that is, if you have a number of insurers, for example, that are providing the coverage that may be possible for a potential client to have or for the client to have, and your commissions are paid by that insurer, how do you sort out the potential conflicts of interest where one insurer will pay a larger commission than another insurer to provide the kinds of benefits or services that the client needs?
Sure. So with any type of insurance, and this is true of even auto insurance and homeowners insurance, you will run into brokers that sell those products just like we're a broker for Medicare insurance products. And the benefit to you, of course, is that you can shop a variety of companies and find one that has the most suitable coverage for your needs, your budget, your usage, your risk. And when you're dealing maybe with a really new insurance agent that might only have 3 or 4 carrier contracts, there might be some leaning or bias leaning toward one coverage over another because that coverage pays a 1% higher commission than a different one. So for the consumer, though, when you're dealing with a really large broker like we are that has, over 30 contracts all across America and writes thousands and thousands of policies every year, you're going to have a lot less issues with that because that broker is going to gain your business by quoting you the coverage that is most suitable for you. So if I were to come along and quote you coverage that costs you $20 more a month than another plan simply because it has a higher commission, I risk losing that sale altogether because another broker will come in and quote you the cheaper coverage and you'll probably switch. So it's always in the broker's best interest to provide you with the coverage that is the most suitable for you. And that involves looking for the coverage that you want that has the lowest price or among the lowest, maybe 2 or 3 lowest price carriers in your area. And also, when you have a broker our size, that need to shop between the carriers for 1% or 2 really is negligible because of the sheer amount, the sheer volume of policies that we write every year. So your broker in that situation is really going to be focusing on helping you find the coverage that's right for you so that they can keep your business for the long term.
Okay, and your company is Boomer, Boomer. Is it Boomer and Associates or Boomer or what else? Give me the full and correct name.
It's just Boomer Benefits.
Boomer Benefits. All right, I'm talking to Danielle Roberts, and here's her book, 10 Costly Medicare Mistakes. And we're going to get into those in a few minutes, and into the next segment. We'll have two segments on this for this morning's show. Now, Ms. Roberts, all kinds of terms out there, seems to me very confusing. Medigap, med supplement, advantage plans. Why can't we just have a simple Medicare program that the government provides to everybody? We don't even have to answer that question. That's too complicated to even answer it. But tell me about these different components that make up a person's big Medicare package, or the umbrella under which they have all of their various Medicare and supplements and Medigaps and all of that. So just take us through these terms. What do they mean, and how do they fit in with Medicare?
So back in the 60s, when Medicare was created and rolled out to the public, it was modeled after the old Blue Cross and Blue Shield style of insurance, which had a hospital side to its coverage and an outpatient side. And then over the years, a couple of parts have been added, but it still functions much the same way. So Part A is your hospital insurance. It's going to cover inpatient hospital care, skilled nursing facility care, hospice care. And this coverage costs nothing for most people because you pay FICA taxes throughout your working lifetime to prepay that coverage for you, so that when you turn 65, you can enroll in this coverage without fear of having to pay a monthly premium. And this coverage you can also think of as kind of room and board in the hospital. Your doctor and nurse are going to come around and check on you, and you're going to be provided 3 square meals a day in a semi-private room. And then the other part of the coverage, Part B, is the outpatient medical coverage, which you and I think of as doctor's visits and lab work, maybe CT scans, things like that. But also Part B can cover a variety of things that might be performed by a healthcare provider in a clinical or hospital setting. So for example, an outpatient surgery may happen at a hospital, but it would be billed under Part B. Part B pretty much covers everything medically necessary that doesn't fall under Part A. So it ranges far beyond just doctor visits and lab work. It includes things like physical therapy, durable medical equipment, medical supplies, diabetes supplies, dialysis, chemotherapy, radiation, lots of things there that Part B covers. And this part is not prepaid. So when you turn 65, you will pay a monthly premium for Part B. In 2021, that monthly premium is $148.50 for most people. If you're in a higher income bracket, you may pay more than that. And all of that cost information is readily available on the Boomer Benefits website or at Medicare.gov. Each year you can look those rates up. And those two parts make up the foundation of your coverage, what we call original Medicare or traditional Medicare, and everything else is built on top of them.
All right, before you get to that, we're going to have about 20 seconds left here before we go to the second segment. We're going to take a short break in just 20 seconds. So I want to tell everybody to stay with us in the next segment of the Law Show. We're going to be talking to Ms. Roberts, and we will cover the 10 costly Medicare mistakes. Actually, we're going to deal with the top 5, and we'll be back after this short message with Ms. Roberts and her book, 10 Costly Medicare Mistakes.